Hi guys, welcome to our channel PKR Vibes Career and Growth. First of all, thank you so much for your time to spending here to learn something new. Today we will discuss about the scenario expenses incurred after the policy effective dates. Guys, not only this scenario in our medical billing, every scenario has a three steps. One is pre-call analysis and the second one is on-call analysis or on-call steps. The third one is the end action on that particular claim. So these are the three steps are very important and every scenario has these three steps. Okay, now we will discuss about pre-call analysis for the PR27 denial. See, this is eligibility denial. So we have to run the eligibility in your doctor software if you have a option, and if you don't have option to run the eligibility in a doctor software, run the eligibility in a doctor's internal clearinghouse. And also you can run eligibility in a respective payers website. So here the purpose why we have to run the eligibility means we have to check whether the policy is active or not. If policy is active, our date of service is after the policy effective dates or not. So for example, if policy is not active, so is there any alternate active insurance is available for this patient or not? So every that information should be available on your eligibility page. So that is the purpose of eligibility for this denial. So the pre-call analysis standard and important pre-call analysis for PR27 denial is to run the eligibility for this policy. So here I give an example: date of service January 15 year of 2024, and the patient's policy effective dates starting from January 1st of 2023 to 12th 31st of 2023 year of 2023, but our date of service is January 15 2024. So if you have to run the eligibility, if policy is active, found date of service within the dates. For example, your date of service, year date of service example whatever I given is after the date of services, so nothing but it's a true denial. For example, date of service is within the effective dates, then you should have to call insurance and prove the same thing, that okay, whatever we have billed the date of services within the date of services, so could you please reprocess the claim because this is a incorrect denial. For example, here I give an example: January 15 2024, dates are January 1st 2023 to December 31st of 2023. So nothing but here the effective dates are here the policy date of service is after the effective dates, nothing but this is a true denial. Like that we have to understand. So here I given 2 points: is coverage terminated or active? If policy is terminated, and find out who is there any other active insurance for this patient or not. If there is no other active insurances, then we have to do the call and confirm the same, then we have to bill the patient. And if policy is active, check, and if policy is active and everything, payer details found and member ID found for that particular active payer, then you have to add that payer in your software and bill the claim to that particular insurance. For example, policy is active but you are unable to get the correct policy ID details for that particular insurance, then you should have to call and confirm the details of that particular policy ID details or claim submission details. Every details you should have to take and you should have to add that particular insurance in your software, then you should have to bill this insurance, bill this claim to that particular insurance. So guys, again I'm repeating, only the very important thing is you should have to run the eligibility, you should have to understand whether your date of service is within the policy effective dates or after the effective dates. If after the effective dates, it is a true denial. If within the effective dates, you should have to reprocess the claim. So if whatever it is, if the policy is not at all active, then you should have to check, you should have to find out who is there any other active insurance to cover this coverages. So in that way you should have to do the understand the pre-call analysis, you should have to do the pre-call analysis. Okay, now we will discuss about on-call analysis for the PR27 denial. For example, we submitted claim to insurance company and we doesn't received any status about the claim. We already checked in our clearing houses and we already checked in our doctor software, and also we already checked in our respective payer portal, and we don't found any EOB. So nothing but we don't know any status about this claim. So at that time, as a AR caller, you should have to call to insurance and you should have to tell that, okay, hi, I am calling from so and so provider's office and checking on a claim status. So because you don't know the status about the claim, so that's what your question is, may I know the claim status please, first question. And the second case is, sometimes what happened, we submitted a claim to insurance and insurance is denied the claim stating that PR27 or CO27. So nothing but they tell that, okay, policy is expenses are incurred after the policy coverage. So at the time, that EOB, denied EOB already posted by payment posting team into your doctor's billing software. So at the time your question is, hi, I am calling from provider's office checking on denied clarification or denied claim status, because already claim is denied. So you have a claim number that EOB already posted in our software. Then your question is, may I know the denied claim status. So there is a lot of difference between the claim status and a denied claim status or denied clarification status. So if EOB already posted, then it is a denied clarification status. So then your next question is, may I know the policy effective dates please, and check whether the date of service, and the question is, may I know the policy effective dates, and also check whether the date of service after two effective dates or not. So if date of service not after two effective dates, nothing but if date of service is within the policy effective dates or before the policy effective dates, then this denial is incorrect. Then as a AR caller, your job is probe the same thing that, okay, whatever we build date of service is not after the effective dates, it is a within the effective dates, and also it is before the effective dates, if example, then you should have to reprocess the claim over the phone call itself with the same information. If DOS after two policy effective dates, then okay, it is a true denial. So that is what you should have to do a analysis and a pre-call analysis. So whether your date of service, whatever we bill to the insurance, is within the policy effective dates or after the policy effective dates. If policy after the policy effective dates, if your date of service, then it is a true denial. If denial is a true, check check on the call with the insurance representative that, is there any alternative active payer for the date of service to cover this patient. If rep told that yes, there is a one more insurance which is active for this patient, then check with the insurance representative for other alternative active insurance details, like what is the insurance name, other insurance name, what is the policy ID for that other active insurance, and what are the effective dates, what are the phone numbers, and also claim details. So you should have to, for example, some reps will provide other insurance details completely, some reps will not provide the complete other insurance details, but they will provide phone number definitely. So in that case, as a caller, you need to take other insurance details and you need to call to that particular other active insurance and need to get the complete policy details and claim submission details. Then your job is, you should have to add that particular active insurance in your doctor's billing software, and then you should have to bill the claim to that particular active insurance. That is as a air caller job. For example, you verified on a call to the insurance representative, like with the question, is there any alternate active payer? Then insurance representative told that no, no, there is no other alternate active payer found for this patient. Then, so you confirm this information on call, right? You should have to take the call reference number, and with that call reference number and also with this confirmation over the phone call, then obviously you can bill this claim to the patient, because patient doesn't have alternative active payer to bill this claim to insurance. So that's what you are billing this claim to patient. So for example, here I given second case now. So denied clarification, nothing but, for example, its EOB is there, it's not required to take all those, this claim number, all those things. For example, you don't have EOB, then you have to take the claim number, and also you have to request the that denied EOB from the insurance representative. Then finally you should have to take the call reference number, and you should have to close the call. So guys, this is the AR caller on call steps for the PR27 denial. Okay guys, now we will discuss about end actions for the denial PR27. Before that guys, if you are watching my video first time, if you not yet subscribed, could you please subscribe my channel PKR Vibes Career and Growth, and hit the bell icon so that you will get every my video as a notifications to your mobile. Okay, here the first end action for the PR27 denial is you need to reprocess the claim. So for example, your date of service is within the policy effective dates or before the policy effective dates for the PR27 denial, then it is a incorrect denial. So then you need to reprocess the claim over the phone call itself. And second end action is you need to bill to alternative active payer. For example, you are verified, you are also confirmed over the phone call that policy is not active for the date of services. Then there is some other insurance is found, that there is some other active insurance is found for the patient, then you should have to bill that particular active insurance. So that is your job. You should have to add that particular insurance in your software, then you should have to bill this claim to that particular active insurance. That is your job action on that particular denied claim of PR27. And the last action I given on this end action, bill patient. So for example, you verified and you confirmed that there is a no other alternative active insurance is found for this policy is clearly inactive, and also you confirmed and also you verified that policy, that you verified that is patient doesn't have any other alternative active insurance. So you already verified in your software, and also you confirmed over the phone call, and also you have taken reference call reference for this confirmation. So obviously you can bill this claim to patient, because patient is liability, patient is responsibility for this claim balance for of a PR27 denial one. So guys, these are the three end actions for the PR27 denial. Guys, if content is useful, could you please like my video so that it will reach us more needy people, and also it will helpful for me. And thank you for your time. Thank you for watching. Have a good health. Bye for now.